Begin by inspecting the chest. Note the shape and symmetry. A normal chest is symmetrical and rises evenly with breathing. If one side lags or does not move, this may indicate pneumothorax, pleural effusion, or lung collapse. The term barrel chest describes a rounded, bulging chest, often seen in chronic obstructive pulmonary disease, COPD, especially emphysema. Pectus excavatum is a sunken chest wall that can compress the heart or lungs. Pectus carinatum is a protruding chest. Palpation checks for tenderness, crepitus, a crackling feeling under the skin from trapped air, or tactile fremitus. Fremitus is the vibration felt on the chest when a person speaks. Increased fremitus may indicate pneumonia, while decreased fremitus suggests pleural effusion or pneumothorax. When percussing the chest, a resonant sound is normal. Dullness on percussion suggests fluid or consolidation, like in pneumonia or effusion, while hyperresonance may mean air trapping, as in pneumothorax or emphysema. During auscultation, you listen to breath sounds with a stethoscope. Vesicular sounds are normal over most of the lungs. Bronchial sounds heard over lung fields may mean consolidation. Crackles are popping sounds from fluid in the alveoli, often heard in heart failure or pneumonia. Wheezes are musical sounds from narrowed airways, common in asthma or bronchitis. Raunchy are low-pitched sounds from mucus in large airways. Absent breath sounds can occur in pneumothorax or massive effusion. Arms and extremities. Start by inspecting the skin and nails. Cyanosis is a bluish discoloration due to low oxygen, often seen in heart failure or severe lung disease. Clubbing is a bulbous enlargement of the fingers, commonly associated with chronic hypoxia, such as in lung cancer, cystic fibrosis, or congenital heart disease. Look for edema or swelling, which may be pitting, leaves an indentation, and is common in heart failure, kidney disease, or venous insufficiency. Capillary refill time tests peripheral perfusion. Normally, the nail bed returns to pink within 2 seconds. Delayed refill may indicate shock or poor circulation. Pulses are palpated at the radial, brachial, and sometimes ulnar arteries. A bounding pulse may suggest fever, anemia, or hyperthyroidism. A weak pulse may occur in heart failure or shock. Absent or diminished pulses may indicate arterial occlusion or peripheral artery disease, PAD. Check muscle tone and strength in the arms. Hypotonia, decreased tone, may be due to neurological damage or muscle disease. Hyperreflexia and spasticity suggest upper motor neuron lesions, like in stroke or multiple sclerosis. Look for tremors or fasciculations. Tremors can be caused by Parkinson's disease, hyperthyroidism, or drug withdrawal. Fasciculations are muscle twitches and can point to motor neuron disease. Abdomen. Start with inspection. Look for distension, which can indicate ascites, intestinal obstruction, or organomegaly. Observe for scars, masses, hernia bulges, or visible peristalsis. Auscultation comes before palpation or percussion in the abdomen. Normal bowel sounds are present and gurgling. Hyperactive bowel sounds may be heard in gastroenteritis or early obstruction. Absent bowel sounds may signal ileus or late-stage obstruction. Bruits heard over the aorta or renal arteries may suggest vascular disease or aneurysm. Percussion is used to assess gas, fluid, and organ size. Tympany is the normal sound from gas-filled intestines. Dullness suggests solid mass, enlarged organ, or acidic fluid. You can also percuss for liver span to detect hepatomegaly. Palpation checks for tenderness, guarding, and masses. Voluntary guarding is when the patient tightens muscles on purpose, while involuntary guarding is a sign of peritonitis. Rebound tenderness is pain upon releasing pressure, often found in appendicitis or peritoneal irritation. Palpate specific organs. The liver should be smooth and non-tender. Enlargement may indicate hepatitis, cirrhosis, or cancer. The spleen is usually not palpable. If it is, suspect splenomegaly due to infection, hematologic disease, or portal hypertension. Kidneys may be palpated for hydronephrosis or tumors. The aorta should be evaluated for aneurysmal pulsation, especially in older adults. Ask about referred pain, like shoulder pain in gallbladder disease or pancreatitis, or back pain in renal colic. Would you